I started looking for a doctor that could do both knees at the same time. And I basically went through 2 months of research. I called PT places all over the city. I thought, first place to go is a PT. Who do you know that's had knee surgery and recovered fast? No one knew about, nor did I, about 3D imaging with the Mako surgery. So I YouTubed and YouTubed and YouTubed. I hired 3 doctors after I met them, and all their, they had the scholastic scaffolding that said, oh, Stanford, Harvard, Yale. But after I did the research, I didn't find that their referrals were that great. They were okay, but some had knee problems afterwards. I didn't want any knee problems afterwards. There is nothing. I drive a Tesla now, and I will never, I don't think ever go back to a piston-driven car. That's what you're doing when you go to a normal doctor who does an image with his eyes and whatever he uses to get that picture. It's an X-ray. It's not a 3D image. So what he's doing is he's taking a Chevy part off a shelf, going into your knee, carving that Ford knee or whatever wear you've had. Let's say we use that analogy, a different car, and they pull parts off that kind of might fit, but then they have to dig into your bone and do more damage to get that piece to fit. 3D imaging is like making a cap, taking a cap off of a bottle, unscrewing it and screwing it back on because it fits perfect. And so 3D imaging, what it does is it takes the picture of your knee 3-dimensionally, which is mind-boggling. And as soon as I saw that, I said, now I know what I'm going to do. And the reason I went to Dr. Reeves, and he said, the first thing he said to me after he saw my image in 3D, he said, why don't we just do both? I said, you're my huckleberry. I wanted to do both at the same time. I didn't want to do one and wait 3 months and go through it again. So once he said, why don't we just do both, the way he said it, and then I checked out his referrals, and this 78-year-old man told me he had his done in July and couldn't remember how long it had been. It had been 6 months. This is exactly the guy I want. So I came in, set it up. I woke up 3 hours later, long story short, and I was, of course, in a drug haze, stood up. They walked me around, and I literally wanted to stay at Inova another day, and I don't like hospitals. And the nurse, I stayed literally about 29 hours. After a double knee partial lateral replacement, just like that old 78-year-old man. And I tell you, there's one thing I would do over and over every single day. I would do this again and again at the drop of a hat if I hadn't already done it. Because it was a quick recovery. It's painless. In the end, I'm the new person that has new legs, and I'm 65, going to be 66 years old. I'm doing everything I used to do. I can run. I literally was running down to the ocean 2 weeks ago. I think I've got 10 people that are coming if they haven't already had it done. Your mindset starts feeling kind of incapable of, you feel like an old man. I'm 65, but I'm not old. I mean, people in Japan climb mountains till they're 104 years old. There's no reason I can't keep going. And now I feel like I'm a new person. Mako surgery, Dr. James Reeves.